The Gates Foundation just made a $50 million donation to fight Ebola in West Africa. That is the single biggest emergency donation you have ever given. It speaks to how serious you think this is. What needs to be done in West Africa that's not being done?
Well, I think we need to move supplies very quickly. I think we need to educate communities very quickly on how they can make sure they don't contract Ebola. I think we need to actually draw blood from people who've had Ebola and recovered from it so we can use their blood or their antibodies and give those to other people. And then back home, we need to be working on the right drugs and vaccines for a long-term strategy against Ebola as well.
The fact that there is no more ZMapp, at least right now, supply, that experimental drug, and there really is very little, nothing approved by the FDA to treat Ebola patients. What does that tell you about our pharmaceutical industry? Some have said, well, you know, Big Pharma just didn't get into this game because, frankly, there wasn't the huge need for it. It didn't make sense to spend all the R&D dollars. I mean, it is a business too, so where's the line?
Well, I think this is what we're waking up to as Americans. It's part of what our foundation has looked at for a long time, is that there are these vast inequities in the world. We do work where there are markets. We work where there's lots of disease. And so those typically are diseases you see in the United States or the United Kingdom. And yet people suffer from other diseases like malaria that we don't get much here. And so we need to make ways that public and private partnerships that it's in the interest of pharmaceuticals to actually invest in those diseases. And they are doing it. I mean, if you look at the investments going into malaria now or into childhood vaccines for diseases that we don't really get in the United States, that actually has been happening. But Ebola was one that was behind.
The first patient just died from Ebola in the United States. Does this need to be a wake-up call to America that this could affect all of us and does have an impact on all of us?
Well, I think we all have to say that any death is tragic. So his death is tragic, just as it's tragic for every parent or child or person who dies in West Africa.
I think people feel very removed, many people,
I think
from
so
West
too.
Africa.
I think so too, and yet we shouldn't. I mean, if we can care that much about one person in the United States who gets Ebola, we need to care that much about the families who are contracting it in West Africa and say, we need to do the right thing, not just because it's right to do at home, it is right to do at home, but those are our neighbors too, just as he's our neighbor.